just had a nosebleed and not sure what to do next. Whether it stopped at home or you just left the clinic, what you do after the bleeding stops really matters. In this quick and easy video, we'll walk you through exactly how to care for your nose, how to prevent another bleed, and when to call your doctor. All in simple, clear steps you'll actually remember. Let's make sure your recovery is smooth, safe, and stress-free. This is patient education made simple, and we're starting right now. Let's start by understanding what's really going on when you get a nosebleed. Your nose is packed with tiny blood vessels. So many, in fact, that they help warm and moisten every breath of air you take in. This is super important for keeping your airways healthy and comfortable. But here's the catch. These little blood vessels lie very close to the surface inside your nose, which makes them easy to injure. So, what causes these nosebleeds? The most common triggers are things like dry air, especially in homes heated during winter, which dries out the inside of your nose. Colds and other respiratory infections also make your nasal passages inflamed and more fragile. And of course, nose picking, a frequent culprit, especially in kids, can easily damage these delicate vessels. Lastly, any injury or trauma to your nose or face can cause bleeding too. When a nosebleed happens, you'll see blood coming from one or both nostrils. It might look alarming, but remember, most nosebleeds are manageable and not usually a sign of anything serious. In this video, we'll walk you through everything you need to know to safely handle nosebleeds, prevent them, and know when it's time to get medical help. So, stay tuned. You've got this. Now that you've had a nosebleed, what should you do once you're home? Let's break down the most important steps for proper care to help you heal quickly and avoid another episode. First and foremost, talk to your doctor before you leave the clinic or emergency room. Don't hesitate to ask questions if anything is unclear. Understanding your doctor's instructions fully is key to making sure you take the right steps at home. Never leave with doubts. Your health depends on clear guidance. For the next 24 hours, it's crucial to avoid activities that might trigger another nosebleed. This includes things like heavy lifting or strenuous exercise, which increase pressure in your head and can cause bleeding. Also, don't bend over too far. Especially avoid positions where your head is below your heart. And very important, don't blow your nose hard or pick at it. These actions can irritate the delicate blood vessels inside your nostrils and cause bleeding to restart. But what if your nosebleed starts again? Here's what you should do right away. Start by gently blowing your nose to clear out any clots or dried blood. This may actually cause a brief increase in bleeding, and that's okay. Next, sit down and lean forward slightly. This helps the blood drain out of your nose, rather than running down your throat, which could make you feel sick. Now comes the most effective part. Pinch the soft part of your nose, just below the bony bridge. Make sure you're pressing on the right spot. Hold this pressure firmly for at least 5 to 15 minutes. And here's the most important tip. Don't keep checking to see if the bleeding has stopped. Peeking too early can disrupt the healing process. If the bleeding doesn't stop after this first try, don't panic. Simply repeat the steps again, but this time hold the pinch for a longer period, between 10 and 30 minutes. Following these steps carefully will help most nosebleeds stop quickly, right in the comfort of your home. In the next parts of this video, we'll discuss when you absolutely must get medical help and how to prevent future nosebleeds altogether. Stay tuned. Your health journey is just getting started. Sometimes, even after you've followed all the right steps, blowing gently, leaning forward, and pinching the soft part of your nose, the bleeding might not stop as quickly as you'd like. That's where a few optional tools can come in handy to give you a little extra help. Let's start with nasal sprays. Over-the-counter decongestant sprays like oxymetazoline or phenylephrine. Brand names you might recognize include Afrin or Neosynephrine. Can help shrink the blood vessels in your nose and reduce the bleeding. Just spray twice into the bleeding nostril, then pinch your nose again as we described earlier. But, and this is important, do not use these sprays for more than 3 days in a row. Overusing them can actually make things worse, leading to something called rebound congestion, which dries out your nose and makes nosebleeds more likely to return. Another simple but effective tool is cold therapy. Grab an ice pack, or even a bag of frozen peas wrapped in a clean towel, and gently place it over the bridge of your nose. The cold helps constrict the blood vessels, slowing the bleeding naturally. Never apply ice directly to your skin, as this can cause irritation or even frostbite. And don't overdo it. Limit cold application to 10 to 15 minutes at a time. And here's one final reminder: stay calm. Nosebleeds can be unsettling, but most are not dangerous. Follow the steps, and give your body a chance to stop the bleed naturally. And when in doubt, call your doctor. It's always better to ask than to assume. You're doing great. Let's keep going. Even after the bleeding stops and you're feeling better, your recovery isn't quite over just yet. One of the most important, and often overlooked, parts of care is follow-up. Your doctor may schedule a follow-up appointment to check how your nose is healing. This is especially important if you had a severe nosebleed, or if nosebleeds have been happening frequently. Why? Because your provider wants to make sure there's no underlying issue, like a weak blood vessel, a growth inside the nose, or a medical condition affecting your ability to clot. So here's what you need to do. Keep every follow-up appointment, even if you feel fine. Why? Because some issues, like slow healing or hidden irritation, might not cause symptoms right away. And don't be shy. Ask questions if you're unsure about anything. Whether it's how your nose should feel, how long healing takes, or what to avoid, your healthcare team is there to help. Also, call your doctor if you notice any of the following. Number 1. Nosebleeds coming back frequently. Number 2. You're unsure whether the inside of your nose is healing properly. Or, number 3. You develop new symptoms, like pain, swelling, or even a fever. These could be signs of an infection, irritation, or a bigger problem that needs to be addressed. Remember, your recovery doesn't end when the bleeding stops. Staying on top of your follow-up care helps prevent complications and gives you peace of mind. Let's keep going. In the next part, we'll talk about what medications your doctor might recommend to support your recovery. Let's talk about something that can really help your recovery: medications. After a nosebleed, your doctor may recommend or prescribe certain medications to support healing and reduce the chances of getting another bleed. First, if there's any sign of infection, or a risk that bacteria could cause problems, especially if your nose was packed or had a device inserted, your doctor may prescribe antibiotics. These help fight infection and keep your nasal tissues healthy while they heal. Second, many people don't realize this, but dryness inside your nose is a major cause of nosebleeds, and it can slow down healing. So, your provider might recommend a nasal moisturizing spray, saline drops, or even an ointment to keep your nasal passages moist. These treatments help protect those delicate blood vessels and prevent them from cracking open again. And here's the most important part. Always follow your doctor's instructions exactly when using any medication. even over-the-counter sprays. Don't use them more often or longer than recommended. Some nasal sprays, for example, can actually worsen dryness if overused. Taking the right medications, in the right way, not only helps your nose heal faster, but also prevents complications like rebleeding, infections, or irritation. So if your provider recommends something, stick with it. It's a key part of your recovery. In the next section, we'll talk about how to safely get back to your normal activities, and when it might be smart to take it easy. Let's keep going. After a nosebleed, especially a severe one, one of the most important things you can do to support healing is to give your body a break. Yes, that means limiting physical activity, at least for a little while. Why? Because certain activities, even things that don't seem strenuous, can cause a sudden spike in blood pressure. This pressure can affect those delicate blood vessels inside your nose that are still trying to heal, and could re-trigger bleeding. So here's what to avoid for now. Number 1. Heavy lifting. Number 2. High-intensity workouts. Number 3. Straining during exercise. Or, number 4. Anything that causes you to hold your breath and push, like during a tough gym session or while moving furniture. Even bending over too far can put pressure on your nasal vessels. So be extra cautious when doing chores or household tasks. The best advice: talk to your doctor about which activities are safe and when it's okay to return to your normal routine. Every person is different, and your provider knows your situation best. In most cases, gentle activities like walking, stretching, or light yoga are perfectly fine, as long as they don't make you strain or hold your breath. But still, ask first, just to be sure. Bottom line, protect your recovery by easing back into activity slowly. Think of it this way: a few days of rest now can prevent another trip to the emergency room later. In the next section, we'll go over smart steps you can take to prevent nosebleeds from happening again. Let's keep going. You're doing great. Now that you're recovering, let's talk about the most important part: how to stop nosebleeds from coming back. The great news is that there are simple, effective steps you can take every day to protect your nose and reduce your risk. First and foremost, keep your nose moist. Dryness is one of the top causes of nosebleeds. You can use a saline nasal spray or drops, available over the counter, several times a day to prevent your nasal passages from drying out. If you live in a dry climate, or it's winter and your heat is always running, run a humidifier at home, especially while you sleep. This adds moisture to the air and keeps your nasal tissues from cracking. When you sneeze, try to open your mouth. That small change reduces the pressure inside your nose and helps protect delicate blood vessels from bursting. If you're congested or have a cold, breathe in steam from a hot shower or a basin of warm water. Steam loosens thick or crusty mucus inside your nose, which can otherwise cause irritation or even bleeding when you try to clear it. And here's a big one: don't pick your nose or stick anything inside it. Not tissues, not cotton swabs. Nothing. These can scratch the surface and trigger bleeding all over again. Also, always check with your doctor before starting new medications, especially blood thinners or nasal sprays. Some drugs can increase your risk of bleeding or worsen dryness. And if you smoke or use e-cigarettes, it's time to consider quitting. Smoking irritates and dries out your nasal passages, making nosebleeds much more likely. It also slows down healing. These small habits can go a long way in keeping your nose healthy, and nosebleeds a thing of the past. Stick around. In the next section, We'll talk about when it's time to call the doctor and what warning signs you should never ignore. Alright, so you've made it through a nosebleed. Great job following the steps. But how do you know when a nosebleed might be a sign of something more serious? Here's when it's time to stop watching and start dialing your doctor. Number 1. You're getting nosebleeds often. More than usual. If nosebleeds are becoming a frequent event for you, don't just brush it off. There could be an underlying cause like dry air, medication effects, or even a blood clotting issue. Recurrent nosebleeds are a red flag. Number 2. Your nosebleed started after starting a new medication. Did your nose start bleeding soon after taking something new, like blood thinners or nasal sprays? That's not a coincidence. Always let your doctor know. Some medications can increase bleeding risk. Number 3. You're bruising easily or all over your body. If a nosebleed happens along with unexplained bruising, that could signal a blood clotting disorder. And that needs medical attention right away. Number 4. You've followed all the correct steps, but the bleeding just won't stop. You pinched the nose, leaned forward, timed it properly, maybe even tried nasal spray or ice. But it's been 15 to 20 minutes, and it's still bleeding. That's your cue. Call your doctor or head to urgent care. The takeaway is simple. If anything feels off, if your nosebleeds are too frequent, too severe, or just won't stop, don't wait and hope for the best. Contact your doctor right away. It's always better to be safe. Up next, we'll explain how to double-check your understanding with something called the teach-back method. Let's keep learning. Before we wrap up, let's make sure everything you've learned sticks with you. And that's where the teach-back method comes in. So, what exactly is the teach-back method? It's a simple but powerful tool used by doctors, nurses, and medical teams to make sure that you, the patient, fully understand your discharge instructions. Here's how it works. After your visit, whether you were in the emergency room, urgent care, or the clinic, your doctor or nurse will go over everything you need to do at home. Once they're done, they may ask, "Can you tell me in your own words what we talked about today?" This isn't a test. It's a conversation. It gives your care team the chance to double-check they explained everything clearly, and gives you the chance to ask questions and feel 100% confident before you walk out the door. Now, before you go home, take a moment to make sure you can say these 3 things out loud. I can tell you about my condition. Do you understand what caused your nosebleed and what might trigger another one? I know what to do if my nose starts bleeding again. That means you can confidently follow the correct self-care steps, like leaning forward, applying pressure, and using nasal spray if needed. I understand when to seek help if the bleeding doesn't stop or happens again. You should know the red flags, like bleeding lasting more than 20 minutes, or nosebleeds happening with bruising or new medications. The bottom line is this: when you understand your care plan, you're empowered. You're not just reacting to symptoms, you're managing them. So don't be afraid to speak up, ask questions, or repeat back what you've learned. Your health deserves that clarity. If you want to dive deeper into nosebleed care, or if you'd like to share trusted information with your friends and family, there are some excellent resources you can turn to. Knowledge is power. The more you know, the better you can take care of yourself and your loved ones. Here are some top trusted sources that offer clear, easy to understand guidance on nosebleeds. First up, the American Academy of Pediatrics. They provide trusted, expert information especially for parents and caregivers. You can visit their site at healthychildren.org, where you'll find a detailed guide called How to Stop a Nosebleed. It's packed with helpful tips to keep your family safe. Next, Kids Health, designed for teens and families. Their site breaks down first aid and health topics in a way that's simple and easy to follow. Check out kidshealth.org for their dedicated page on nosebleeds. Perfect for young people wanting to learn how to handle these situations confidently. And finally, NHS Choices from the United Kingdom. The National Health Service offers clear medical guidance that's trusted worldwide. Visit nhs.uk and search for their Nosebleed information page. A reliable resource if you want authoritative medical advice from the UK. Whether you're a parent, a teen, or just someone who wants to be prepared, these resources are goldmines of information. Remember, sharing accurate health information helps protect your community. So don't forget to pass these links along to your friends and family. Because when it comes to health, we all win by learning and sharing together. Thanks for watching. Now you know exactly what to do after a nosebleed, how to prevent it from coming back, and when it's time to call your doctor. Remember, something as simple as using a saline spray or avoiding nose picking can make a huge difference in preventing future bleeds. And if you're ever unsure, don't guess. Always check in with your healthcare provider. Knowledge saves stress, and sometimes lives. If you found this video helpful, give it a thumbs up to let us know. Drop a comment below if you've ever had a nosebleed or learned something new today. And don't forget to share this video with friends, family, or anyone who might need this info. Because you never know when a nosebleed will strike. Hit that subscribe button and turn on the bell so you never miss a quick, clear, and trustworthy health tip. Right here on Patient Education Made Simple. Check the description below for links to trusted resources and more videos just like this. Stay healthy, stay prepared. And we'll see you in the next video.